Hi, and welcome back to the show. Today we'll be speaking with Dr. Nick Masri. He is with Face and Body Cosmetic Surgery in Miami, Florida. Well, Dr. Masri is a board-certified plastic surgeon who has been practicing medicine in southern Florida for almost 20 years. His surgical skills are derived from his comprehensive training in both general and plastic surgery. He has the rare distinction of holding dual certification from both the American Board of Plastic Surgery and the American Board of Surgery. He is also a fellow of the American College of Surgeons. Dr. Masri, thank you very much for joining us on the program today.
Thank you very much for having me.
So first of all, tell our audience a bit about what are some of the common procedures that you practice here at your practice?
We have a very broad-based practice. We deal in all types of plastic surgery. We have a special emphasis in a new, or probably one of the latest specialties in plastic surgery, which is post-bariatric plastic surgery. The post-bariatric plastic surgery is it's pretty much a comprehensive face and body type of surgery, where it targets people who've had massive weight loss. Typically, this massive weight loss can be through bariatric surgery or just general weight loss through diet and exercise. The procedures comprise a lot of different things, including face lifts, neck lifts, arm lifts, breast reductions, tummy tucks, thigh lifts, you name it. That's one of the exciting things about the specialty, is that there are so many different types of procedures that encompass it.
And Dr. Masri, I heard about the mermaid lift. Can you tell me a little bit about that as well?
Well, because of our experience with a lot of post-bariatric patients, over the last 12 years, we've dealt with thousands of patients who've had massive weight loss surgery, or have lost weight, or have had skin issues over the years. And we came across a procedure, interestingly enough, that was, it was almost named by some of the nurses that we work with, in that while doing lower body lifts, they noticed that it gave special contours that were designs found on wedding dresses. And I guess these wedding dresses were called mermaid gowns. So we found that some of the nuances in these procedures that we were performing actually gave these contours and shapes. And specifically, those are the tightness that's achieved through a nice tummy tuck. We accentuate the buttocks and the waistline. We lift the mons pubis area. And at times we tailor some different procedures, such as a breast lift or breast augmentation, and maybe even at the time an arm lift, just to really give it the ultimate in plastic surgery procedures. It's really exciting. It's something that even doing this for as long as I have already, I'm very excited about doing the procedure, and I'm very excited about finding patients who are good candidates for these procedures.
So who would be a good candidate for the mermaid lift or other post-bariatric plastic surgery technique?
I think there is a lot of people, or there are a lot of people who have had post-bariatric surgery who are great candidates. There are a lot of people who've lost a lot of weight themselves through diet and exercise. There are a lot of people who've had children and have had the effects of aging on their bodies in such a way that all of these people comprise potential candidates for this procedure. Interestingly, there are some people who in spite of their massive weight loss, they still really aren't optimal candidates. But for the most part, anybody who's had massive weight loss realizes that there are a lot of issues related to skin laxity and excess skin. And there are a lot of regular or common plastic surgery procedures that just don't address those to really get the benefit or the satisfaction of having lost so much weight. So I think, by and large, most people who would be good candidates for this procedure are people who've really achieved their weight loss goals, people who've done it in a healthy, supervised manner, and people who really want to see improvement in contour and shape after their weight loss.
So, Dr. Masri, how should a patient actually prepare for a procedure like this? Whether it's the mermaid lift or the post-bariatric plastic surgery of all the other types that you offer?
I think the most important thing is to make sure initially, for those people who've had bariatric surgery, to make sure that their bariatric surgeon essentially agrees or recommends that since they've achieved their weight loss goals, their weight loss has pretty much leveled out, and they've been nutritionally optimized subsequent to that weight loss, then usually they are candidates or they're ready for that procedure. Now, the timeline for that varies, but in most cases, anywhere from 8 months to a year is a time period that most bariatric surgeons suggest that patients are ready for these types of procedures. Again, adequate diet, adequate exercise, and just nutritional optimization are probably the best preparation for these procedures.
And what about the actual procedure itself? What's actually involved in that procedure?
Well, these procedures they can be extensive procedures. They range anywhere from 2 to 8 hours in duration. These procedures are performed in the hospital. We certainly enjoy the safety of the hospital environment. In most cases, depending on the surgery, we require an overnight stay, which is what we call a 23-hour observation stay. The procedure usually involves, preoperatively, of course, we've counseled the patient, we've given them our recommendations related to the procedures, and of course, keeping in mind their expectations of what their goals are. We ask for preoperative medical clearance, typically from their primary physician, and we also, of course, as mentioned, like the recommendations from their bariatric surgeons as well. And in most cases, we have a team of everybody in our office has a lot of experience with these procedures and has a lot of insight into how a lot of our previous patients have fared, and a lot of the questions that they've had over the years. There's rarely a question that can't be answered. So we like to spend a lot of time in actually discussing expectations for these procedures with our clients, and to make sure that people are aware that it's a real surgical procedure. In return, it offers real surgical results.
And then once they've left the hospital, what's on average the recovery time?
That really depends typically on what type of procedure is performed. In most cases, we like to say that your recovery time is about 2 weeks. And for most procedures that we do, we generally say 2 weeks. For example, a breast reduction is typically 2 weeks. Tummy tucks are typically 2 weeks. Smaller procedures such as breast augmentations or breast lifts can be less than a week. Arm lifts are less than a week. But when we talk about some of the more intensive procedures such as lower body lifts or mermaid lifts or thigh lifts, those procedures typically can take anywhere from 2 to 4 weeks to recover. Now, when we speak of recovery, we typically refer to that period of time which it takes you to return to work, go back to school,
right.
Engage in your normal daily activities.
Well, Dr. Masri, it was wonderful having you on the show. You've shed some light on the mystery of plastic surgery, and it's very interesting what you're doing there with the mermaid lift. Thank you very much for joining us and showing our audience a little bit more about that industry.
Thank you very much for having me. I appreciate the opportunity.
We've been speaking with Dr. Nick Masri. You can reach him several ways. You can visit facebody.net or miamimermaidlift.com. Now, both of those sites have comprehensive information, photos, before-after shots of Dr. Masri's procedures. Check out those websites when you have a moment. If you want to reach Dr. Masri by phone, his number is 305-262-6484. So thanks once again, everyone, for joining us, and we'll see you again real soon.